Let's talk fertility or infertility now. It affects a growing number of couples here in South Africa. To discuss this, we're joined by Dr. Antonio Rodrigues. He's a Reproductive Medicine Specialist at Medfem Fertility Clinic, a very popular name when it comes to fertility. A very good morning to you, Doc, and thanks so much for your time. Let's first talk about infertility and fertility and what we're seeing happening. I have to bring in COVID here as well. In this time, are we seeing a drop in the number of couples that are coming to you for help?
Morning, Rebecca. Thanks for the invitation, and good morning to all your listeners. Yes, I think in terms of our ongoing patients, we're carrying on treatment. They're very keen to actually do treatment during this time for the obvious reason that they're fertility patients. They're very aware that time is important. As we know, time over, when you're talking 6 months, a year, 18 months, that's a long time in terms of the fertility rates and fertility rates dropping. So our patients at the moment are very aware of it. New patients are less, there's no question. I think patients are worried about going to clinics. We are lucky that our clinic is a standalone clinic, so it has an ability to be screened properly and doing all the necessary things, and hopefully we can limit any COVID contamination or contagiousness by strict controls of people. We also ask our patients to self-screen themselves twice a day during this time. So we've got a lot of mitigating factors that we are doing. But yes, the answer to your question, there's a slight dip in the number of patients that are coming as new patients, and obviously our international patients can't get into the country at the moment, want to be here, but can't be here at the moment.
All right, so COVID aside, and I just want to talk traditionally, sort of before this pandemic hit, and you saw obviously fewer people coming to you for those reasons, but in general, in South Africa, are we seeing that more and more couples, because let's just say it's not just often the woman who has the issue, it could be the man as well, are we seeing more and more South Africans dealing with something like this, trying to have children or battling to have children?
Yeah, no question about it. I mean, we know there's if we take out the patients that have tubal disease or males that have had blocks in the testes related to infection, if we look at the other group of patients, we look at lifestyle diseases, and these lifestyle diseases include high insulin levels, problems with thyroid, autoimmune disease, endometriosis, polycystic ovaries. That whole bundle of conditions are actually driven by lifestyle, and that lifestyle includes diet, stress, obviously smoking, excessive alcohol, and that whole broad picture and people having babies later. That's very important. Yeah. Definitely a problem for us, you know.
All right, well, I'd like for you to expand on that for us, on these factors that are contributing to infertility, Doc, at the moment. And let's talk about those lifestyle, you know, those factors that you just brought up now. And also, is it something that could be also attributed to genetics?
Yeah, look, I'm not the best at genetics. I believe that there can't be so many changes in all our genes over the last 20, 30 years that we all got these problems. Suddenly, genetics takes a long time to evolve. Having said that, you know, you also have learning in terms of what happens at home. Diet plays a very critical role in this. You know, excessive carbohydrates in the diet are a big problem. Whether that person is overweight or not, when they come here, patients have polycystic ovaries. They tend to have high insulin levels. They often don't know that they've got high insulin levels, and we manage those insulin levels both in men and women. Men aren't out of this one. If guys have sperm problems, they often have high insulin, hypertension in them as well, related to this high insulin. So we aggressively treat insulin problems. We like people to try and manage their dietary intake. And in the female, that plays a big role in creating a higher incidence of what we call polycystic ovaries, where there are factors which make the ovary not ovulate properly, and by managing those conditions, you get to a point where they ovulate properly. And then the men, when they've got, we see a lot of men these days. In fact, in couples, often 50% of the couples we see have a dual problem, and in the men, that problem is often a very low number of normal sperm. And by treating lifestyle, we can get it right. So that's in terms of diet. So diet plays a big role. And as you know, we've had a big interest at Medfem in stress and infertility for the last 21 years. The time urgent perfectionistic stress that people are under definitely affects it. And just as an anecdote to that, what was interesting at the beginning of the lockdown, we saw a trend of people falling pregnant at a higher rate on couples that actually had a very low chance of being pregnant naturally. It seems to have changed a bit at the moment. I think stress is starting to play a role again. But in the beginning, it actually was a positive thing.
In terms of finding out whether you will be able to have children, how early can a woman or a man actually go out and do tests to actually find out if they will be able to have a child of their own? And also on that note, are you seeing a lot of people coming in to sort of freeze their eggs these days in this country?
So first, on the first part, if you are someone who isn't ready to have children, you can, on a woman's side, they can ask their gynecologist to one, scan their ovaries, and they can do a hormone level called anti-Mullerian hormone, AMH. Gives you an idea of where you stand in your egg numbers. Sometimes patients of 25 might not have a lot of eggs. So that is something that can be done at routine checkups when you're seeing your gynecologist. In terms of a male, the only way that he can check is to go and have a semen analysis. Obviously patients who are absolutely fine and they try and have a baby can try naturally for a period of time. But if someone has any problem, if they have irregular cycles, if they've got pain with their periods, if the guy has a history of the possibility that he might have a problem, it's better to be checked early. And your last question there, are we seeing an increase in people freezing eggs? Yes, absolutely. There is starting to get a trend that women are realizing that their marriage plans or plans in terms of their work are out of sync with having a baby, and they are coming and freezing eggs. What I would just recommend there is not to leave it too long, because we're seeing more women in their over 35s coming to freeze eggs, and it's fine, but it's not ideal. You should be freezing eggs in your late 20s, early 30s if you think you're going to delay your fertility.
All right, Doc, and it also takes quite an emotional toll on couples as well. And just a very quick word when it comes to stigma and just what we see, couples facing or dealing with this issue these days. What do you tell them? What are the conversations you're having with them about this?
So, we try and actually make sure that the couples are, first of all, comfortable with what we're doing with them. And the second thing is, sometimes that stigma, you need to decide who you're going to be telling this to, There is no reason to be discussing your fertility problem with everyone. Having said that, obviously if you're the only person in the crowd who hasn't got a child, there's one of two reasons. You're either accused of worrying about material things in life, and you can't discuss your problems. And the other thing is, we do find that sometimes, it's a pure male factor problem, but unfortunately the female gets blamed for it. And, we try and counsel our patients. It's very important for us to send our patients to our in-house psychologists to discuss these factors, to feel comfortable in their own space. And I think it's about your own space. It's about your own feelings. To be honest, again, people out there, not too important. Be in your own zone. Look after yourselves, focus on yourselves, and you'll win at the end of the day.
Right, thanks very much for that, Dr. Antonio Rodrigues. Just remember, you're not the only ones going through this. Others have overcome as well. Thanks so much for that discussion. Well,